All right, Anna, do you have anything else you'd like to talk about today?
Yes, actually, because I have some missing teeth, especially in the front, I'm really embarrassed to smile,
Okay.
and especially in pictures, it's really embarrassing. So it's something I'm very subconscious about.
So what we would recommend probably would be a partial denture in that situation.
A removable partial denture is a denture for a partially edentulous patient who desires to have replacement teeth for functional or aesthetic reasons and who cannot have a bridge or implant for any number of reasons.
So why would you recommend a partial denture over something like implants?
Well, because you do have some teeth missing in the front and you do have a couple missing in the back. You have several teeth that do need to be replaced, and a implant could cost upwards of $1,000 per tooth that you need. However, you could get a denture for the same cost as you could get for one implant. So this will replace all of your teeth, and it's removable. It's not permanent. There's that many systemic complications that you can have with this. Like with implants, they can get infected, they can reject, whereas this, if you need it adjusted, you just come back in the office, we'll adjust it for you. And they replace multiple teeth at the same time, so you can replace your front teeth and you can replace the back teeth that you also have missing.
Advantages of a partial denture include lower costs, the ability to replace multiple teeth at once, both anterior and posterior, and there is no recovery time or healing like with implants and bridges.
So what do I have to do to get a partial denture?
So basically what we'll do first, our first appointment will be taking a series of impressions of your teeth that you do have in your mouth now, including the spaces where you do have the missing teeth, so that we know where to put the teeth on your partial denture. We'll also take a wax bite, where you'll bite down into wax so we can register how you bite and make sure that your normal teeth will bite down the same way as your denture does. And we'll also, after that, we'll send it out to a lab who will formulate something that looks very similar to this right here, except it'll be made out of wax, so it's easily adjustable, and then we send it out one more time. You come into the office, we register, we use the wax mold, and then we will from there send it out one more time, and then they'll create this resin denture for you. You come in for that appointment. This will be the third appointment. We'll do some final adjustments, and then we'll send you home and see how you like it, see how it fits, see how you're eating, see how well you like it, and if it needs any more adjustments. And sometimes it can take up to 2 or 3 adjustments for the denture to fit correctly. So you might be back in the office for about 4 or 5 appointments, but after that you'll have a denture that should last you a very long time.
Okay.
The process for getting a partial denture can take between 4 to 5 appointments, and the process includes impressions, bite registries, trying on a preliminary denture and making adjustments, and then receiving the actual denture and making the final adjustments. Additional appointments may be needed to make further adjustments.
Okay, so how do I keep these clean, and how often do I have to take them out?
So I know that aesthetics is a very important to you because you are missing the front teeth, and I know that was your complaint earlier. So you wouldn't have to remove them during the day. You can eat with these in. However, at the end of your day, when you're getting ready to go to bed, we do ask that you to keep these as clean as possible and to keep them lasting as long as they can. That you take them out at the end of your day. You brush them with a soft bristled toothbrush and a non-abrasive toothpaste, and then you rest them in a bowl with a denture cleaning tablet, which creates some fizz and kind of bubbles anything off that you missed with just brushing it alone. So that you have to do that every day, but you can wear it throughout your day, and in the morning you'll have a fresh clean denture. As long as you follow those steps, you'll have a fresh clean denture every morning to put in.
Okay.
Partial dentures can be left in all day, but must be cleaned daily along with remaining natural teeth to prevent calculus buildup, bone loss, gingival inflammation, and caries. Using a soft bristled toothbrush and non-abrasive dentifrice in combination with a denture tablet can help prevent these issues from occurring.
Some other important things that you do need to know about having a partial denture: if you do in the future you lose a lot of weight, or if you gain weight and lose weight, sometimes that will cause them not to fit, but that's a very easy fix. You just come in for an adjustment to the office, let us know that it's not fitting correctly, and we'll do our best to make an adjustment that will fit you, and make sure that you can still wear your denture every day and that you don't need to get a brand new denture. You are also, like I was saying, it's important to clean them because that also removes the risk of causing more irritation to your gums and your palate by making sure that they're clean and that you're changing them out every day, you're giving your mouth time to breathe. And then you also need to make sure that when you're putting this in your mouth, you need to make sure that you're pressing down, putting it in yourself, and using your pressure from your fingers to seat the denture rather than biting down, because that could actually snap the little clasps that hold on to your teeth and keep the denture in.
Okay.
And with a partial denture, like unlike a full denture where you need to use a wafer or some sort of a paste to keep it in, these ones do clasp right onto the teeth, so you don't need to use any additional pastes or anything like that. They should stay in right on their own. They should stay clipped to your teeth and be easily removable.
Other important considerations include recognizing that weight loss can affect a denture's fit and that an ill-fitting denture can cause more issues than it originally solved. Remember to always seat the denture using digital pressure rather than biting down. This preserves the clasps that keep the denture in place.
So do you have any more questions? Have I answered everything you wanted to know about partial dentures?
Yeah, I don't have any more questions, so let's just go ahead and make the appointment to start the process.
Okay, awesome.
Removable partial dentures may not be for everyone, so make sure you discuss with your patients what is best for them on a case-by-case basis. It's also important to remember that although most removable partial dentures are acrylic, there are some made with nickel, so make sure that your patient does not suffer from a nickel allergy if they decide they would like a removable partial denture.